Hi, class. Me and Fernando were doing the country of Thailand, and we are discussing the effects of HIV in Thailand. My name is Sarah Gissinger, and this is
Fernando Samaripa.
So first, we're going to discuss Thailand demographics. Fernando?
Demographics of Thailand is population is about 68 million people. 50% are rural, and the other 50% live in urban civilization. Life expectancy is about 74 years, and infancy mortality is out of every 1,000 births, there's 12 deaths. Unemployment is at 0.9%, and per capita income is at 7,640. The culture is predominantly Buddhist. Some of the health problems, according to CDC, number one cause of death is cancer at 19%, and our topic, HIV, it comes in at number 5 with 4%. Epidemiological problems. Incidents, we have approximately 7,000 new cases each year, and prevalence, there's approximately 450,000 individuals, about 1.1% of the population living with HIV. Mortality is 28,000 people per year, which is well above the median of 1,000 per year in the world. Trends that have been going on in the 90s, they had an epidemic, and they had 150,000 new cases. In 2000, they got it down to 28,000, and 2010 it was down to about 10,000. But this downward trend seems to be slowing down. According to the United Nations Center for Disease, in certain areas it is picking up, and it partly has to do with education and resources. All right, HIV is transmitted through sexual intercourse. And we lost it. Okay, HIV is transmitted through sexual intercourse, and a lot of the times it's due to lack of education or just having unprotected sex. According to the UN, 30% of people ages 15 to 24 know how to properly prevent sexual transmitted diseases. And 14 to 21% of women living with HIV who do not have desire to become a parent and resort to condom use as their contraceptive become pregnant within the first year of becoming strictly condom users. And another way of passing on the infection is through mother to child, as mentioned earlier. And the transmission can be prevented with drugs, but at times for certain individuals, certain women, there's drug-to-drug interaction that can lead to the child having low weight, aborted, or being born with HIV. Another way that can be transmitted is through drug users, needle drug users. In a particular study, 2,413 individuals who are drug users, needle drug users, were followed for approximately 4 years, and none of these were initially having the HIV virus, and at the end of the study, 50 of them had the HIV virus. Next slide, please. Here we go. And this is our epidemiological triad, and our vector is going to be us, since we transmit the virus through our blood, semen, rectal, and fluids and milk, and our environment is going to be our bodily fluids, as mentioned earlier. And the agent is the human immunodeficiency virus, and it is active infectious from the beginning. It is dormant for about 10 years, depending, give or take, on the individual. If is left untreated, once it becomes AIDS, there's about a 3-year survival rate. And in order to stop this triad connection, we have to break one of the kinks through education and providing resources for prevention. Next slide, please. Next slide. All right, cultural barriers. There's negative attitudes and stigmas placed upon those infected, which these stigmas and attitudes prevent them from seeking treatment, seeking testing, letting family or partners know that they are infected because they're aware of what happens to their peers around them when they do come out and tell them that they're infected. There's the lack of social support forces some to live in life of secrecy. They hide their medications, they skip doses when their loved ones are around, or they just plain decide not to take it because it's another way of their family or their other loved ones to find out that they're HIV positive. And HIV is prevalent among sex workers, and there's also an inequality within the sex industry, as heterosexuals percentage have gone down based on infection, but homosexuals has remained at around 30%. And this also has to do to the inequality behind resources and education guided towards the homosexual and the transgender community. Another aspect that the culture plays in is a majority of the population is Buddhist, as mentioned earlier, and the traditional beliefs is karma, and a lot of the street workers or sex workers, their hardships and maltreatment and anything that they're going through is seen as a way of repayment through karma for previous actions that they've taken. And that does it for cultural barriers.
Okay, guys. So I'm going to be doing some of the HIV health promotion and treatment interventions that are offered in Thailand. So in Thailand, HIV testing and counseling have become available. In the last few years, they've implemented a lot of community-based clinics where counseling is offered. So that's generally counseling and education prior to HIV infection is considered to be a primary prevention because it is focused on education. Now, once the counseling becomes part of treatment with someone who has an active HIV infection, that becomes a secondary prevention. There are also clinics that offer HIV testing, and they're trying to get those clinics to offer testing with same-day results, so that's a form of secondary prevention. It's important because these clinics are part of the communities that they serve, so that's what they're trying to push for, to get better results and to get in touch with parts of the community that need these services the most. So what they're doing now is focusing on targeted populations, populations such as the youth, homosexual males, sex workers, and the transgender community. Another thing that they're doing is they're trying to focus a lot of their efforts on HIV prevention and education for people under the age of 25. A lot of the younger citizens in Thailand don't have a lot of education and knowledge about HIV, how it's transmitted, and how it generally can become AIDS, and they just don't know how to protect themselves, and they don't know a lot about their own reproductive health in their bodies. So what the Thai government is trying to do is they're trying to extend sex health education and prevention activities to schools and communities in need, especially the targeted communities that I mentioned before. They're also trying to get a hold of young people and youth that are not in school. So although these interventions have been helpful, they're only shown to succeed when they're very intensive in the schools and communities that they serve. And the evidence right now is just too minimal to show that these interventions are really affecting the national STI rates. As of 2012, Thailand enacted a national AIDS strategy to target youth and improve access to services by changing laws and policies and increasing reproductive and HIV education amongst high-risk populations. One of the things that they did was that they turned over a law that said that Thai youth under the age of 18 could not get tested for HIV and could not receive counseling. Now that they've overturned that law, Thai youth are allowed to receive testing but they have to have counseling first. And under this agreement, they don't have to have permission from their parents to get tested and to get some information about HIV. So another thing that the Thai government is trying to do is they're trying to prevent mother-to-child transmission and reduce it, and they've had great success doing this. As of 2016, Thailand is actually the first country in the Asian Pacific region to reduce mother-to-child transmission to under 2%. That's a pretty big deal, and that's a really strong statistic. There are some areas of improvement, though, that need to happen. The Thai government is trying to increase participation in programs that include HIV testing for couples that are pregnant or trying to become pregnant. In 2014, they reached a goal of 41%, and their 2016 goal is a 16% participation rate. They're not quite there yet. Another thing is care for HIV positive foreign women that are pregnant is completely inaccessible unless they pay quite a bit of money for those services. And many currently pregnant women are not registered for prenatal care, meaning that they're not learning about their HIV status and that their unborn child could be potentially at risk for acquiring HIV because the parent perhaps doesn't know or mother doesn't know that she may be positive. So those are things that the Thai government is working on, but they are doing actually a really good job in reducing the number of mother-to-child transmission. The treatments available in Thailand, and these sorts of treatments, these antiretroviral treatments, are considered tertiary care, meaning that tertiary interventions, meaning that the patient has HIV, has the illness, but they're able to make them more comfortable and help them have a better quality of life. So they're treating that. In 2013, Thailand and Cambodia were the only two countries in Asia and the Pacific that had a 50% or more HIV population on antiretroviral treatments. The 2016 goal is to have 90% of the population that is HIV positive on antiretrovirals, but because more people are becoming eligible to take these drugs, they're not quite at that 90% goal just yet, but they're making good progress towards it. There are a few barriers to HIV testing and treatment, and some of those are for undocumented migrants. They still face a lot of discrimination from law enforcement officials, healthcare workers, and employers. Also, intravenous drug users face some stigma and discrimination, as well as the LGBTQ community in Thailand and some of the sex workers there. So because of this, sometimes people are avoiding seeking care or testing. Sometimes some of the healthcare workers treat them poorly, and so they don't want to access care. And sometimes they lie about their status, or they lie about certain things because they don't feel comfortable sharing that with some of the healthcare professionals. So unfortunately, the stigma against some of the HIV positive people causes them to avoid services. The role of healthcare professionals, like I said previously, some of them do treat some of the patients differently or poorly. Sometimes they breach confidentiality, and sometimes patients feel judged and discriminated against. But ultimately, there are really good doctors and nurses and healthcare professionals in Thailand and that are making a huge difference and are creating the foundation for a lot of progress in HIV/AIDS education, care, and treatment in Thailand. They're really expanding their role in education and reducing stigma and reaching more segments of the population. Anyway, we've run out of time. Thanks so much, class, for taking a look at our Thailand presentation, and we appreciate you tuning in.